Well, for medical students, Arnett Health offers a unique and gratifying residency experience here in the Twin Tiers. And this week's Community Health, WENY's Renata Steele speaks with a doctor about the hospital's medical program and the sort of benefits it offers its students.
Hello and welcome to this week's edition of Your Community Health. I'm Renata Steele with WENY and I am talking to Dr. Richard Terry. And Dr. Terry, you are the Director of Medical Education here at Arnett Health, and you are also an Assistant Dean for the Lake Erie College of Osteopathic Medicine, better known as LECOM. And we are talking this week about Arnett as a teaching hospital. You have a number of medical residents in your program. Talk a little bit about the program and the residency that some of the doctors are in here.
Excellent, thank you. We have about 85 residents now, residents and fellows across 10 different programs, several pipeline programs in family medicine, emergency medicine, and radiology, as well as internal medicine. And those are programs that lay the foundation for either a primary care doctor or a specialist. We also have some fellowships in cardiology and endocrinology and gastroenterology, and those are specially trained, so we train specialists. So, it might come up, well, why would a community health system such as Arnett, which has been around obviously for over 100 years, embark on teaching? And this occurred about 5 years ago, this revelation that, to sustain, one had to train. One had to offer some ability to train people and attract them to come here and invest in our community. And indeed, that is exactly what's happened. We've started these programs in family medicine and internal medicine, and we've now trained doctors, very good doctors, who have stayed in the community. We're also finding now some of the specialty doctors we've trained are also staying in the community. So the idea was to create a supply chain of doctors for us. And Arnett, obviously a moderately sized health system with excellent teaching opportunities, excellent faculty, along with a collaborative effort from a university program of Rochester, namely, we've been able to offer a very well-balanced training program, both in our primary residencies and some of our specialty residencies, and I think produce some very, very good doctors.
And you mentioned being able to, this system, to attract doctors to this area to get their education and then staying in there, staying in this region. For the patient, what's the benefit to the patient, to the community, by having doctors in residency and training here in the Elmira area?
Well, when you're teaching, it keeps you current. It forces everyone to be at the top of their game because they're involved in education, whereas it's virtually impossible to keep up, as a physician these days, and harder if you're not involved in education because things change so rapidly. So by virtue of becoming an academic health center really has caused everyone to be at the top of their game to make sure they're practicing and teaching the latest in evidence-based medicine.
And now as a patient, if I am at an appointment and my doctor comes in and they are a resident, what should I expect?
Well, first of all, if they're a resident, you'll know they're a resident. They will tell you they'll always be working under the supervision of an attending at some level. Either they'll directly be there, direct supervision, or within the hospital somewhere will see you. So understand they are certainly supervised, but on the other hand, they are fully credentialed via medical education as physicians. In fact, all of ours are license eligible by the time they finish their first year, so everyone has met the criteria for licensure in the state of New York. Not all of them intend to practice here, so they don't all actually get their license here, but they have, they've all passed the appropriate examinations to achieve that. So they're competent, very competent. There's also some very stringent standards for them to advance. So I'd be very comfortable.
Right. Well, Dr. Terry, thank you so much for filling us in about the residency program here at Arnett Health and LECOM. They're a wonderful program as well. And we want to thank you for joining us for this week's edition of Your Community Health.